If you're suffering with back or neck pain, you're not alone. In fact, back pain is one of the top 10 reasons people visit their doctor. It is important to know that in the majority of back pain cases, high-risk surgery should always be your last resort, and long-term reliance on over-the-counter and prescription pain medications can be very dangerous. Every year, Americans spend more than $50 billion on back pain, and that's just for the more easily identified costs. Studies have reported between 15 to 20% of our population has back pain at any given time, with 32 million new cases every year. We now offer a breakthrough technology called spinal decompression therapy, and it's very effective in the treatments of back and neck pain, even for those who have had back surgery. The most common cause of those new back pain cases is a structural problem related to the spine. Many people continue to suffer until that structural problem is addressed and corrected. They're also very susceptible to injury from everyday activities, producing increased pressure due to improper loading on spinal joints and discs. Healthy spinal discs are very strong and can withstand a great deal of wear and tear. As stress on discs increase from repetitive lifting or years of sitting, structural fibers eventually break down and cause small cracks and fissures in the outer third of the disc. These cracks allow the soft center to move outward, causing a disc bulge or a herniation. People are sometimes surprised by how suddenly their back pain appeared and can become frustrated because of the lack of a specific injury. Statistics show that once you have suffered an episode of back pain, you have an 84% chance of suffering recurring episodes. This will likely continue to occur again and again until proper corrective treatment is obtained. You'll notice your pain will occur more frequently and with less provocation as each painful episode becomes more severe, lasts longer than the last episode, and is more difficult to resolve. Unfortunately, people usually allow things to get worse over time as they continue to live by those 5 dangerous words, "maybe it will go away." Over-the-counter prescription meds are commonly prescribed for back pain sufferers trying to find relief. Medications can temporarily decrease pain, but you'll quickly discover that increasing doses of medication will be required to get relief as the pain becomes more severe with each progressive episode. You'll consume more and more medication, just masking or suppressing the symptoms, and without the warning signs the pain provides, your medicated body has no way to prevent additional injury and damage. Work and everyday activities can continue to damage your back, increasing your underlying problem. Once the drugs can no longer suppress your pain, your doctor may recommend physical therapy. But seldom does physical therapy treatment include non-surgical decompression treatment. Each decompression treatment takes just 30 minutes and 20 to 25 sessions over 4 to 6 weeks to completely restore function and ensure complete healing. For effective decompression traction, the table is then adjusted and set to the proper tension and angle for distraction, allowing the specific discs that are causing your pain to be targeted for correction. If spinal decompression therapy is right for you, we will work out a payment arrangement so that you can afford the corrective care you need. We also treat people who have no insurance, so please don't let money prevent you from regaining your full health potential and leaving your pain behind for good. The majority of our patients report significant relief after just a few decompression treatments. Patients frequently describe decompression therapy as a gentle, intermittent pulling on their back. And many find spinal decompression therapy so relaxing that they have even fallen asleep during their treatment. Discover the benefits of spinal decompression therapy. You've got nothing to lose but your pain. So take the first step to living pain-free once again with spinal decompression therapy.